For every student facing difficulties, there's opportunity. For every community in crisis, there's hope. For every person trying to make things better, there's a way. Every day across Missouri, community coalitions are working to build stronger, safer communities through evidence-based prevention programs. 10 prevention resource centers exist statewide to help support these coalitions as they build resilient families and communities. Funded through the Missouri Department of Mental Health's Division of Behavioral Health, prevention resource centers offer technical assistance and support to the coalitions in their service areas, providing volunteers and staff with training, connections, and resources to help them secure funds, develop programs, and ultimately grow healthy communities, improving outcomes for individuals and for Missouri as a whole. From merchant training to drug disposal programs, prevention resource centers have an active role in prevention at every step, including in-school teaching and mentorship, and advocating for policy change on a local and state level. From rural back roads to crowded city neighborhoods, change is happening across the state because mental health support, substance use prevention, and safe communities go hand in hand. Because communities that are supported can thrive, prevention is possible.
I'm the manager of trauma-informed care. I help advance trauma knowledge, practices for all kinds of industries and professions that are impacted by trauma so that they can deliver better services and take care of their workforce better. And then I'm also the director of this disaster response state grant.
I want to know more about the risk factors of those people who have experienced loss and grief resulting from a disaster. What is the, how are survivors vulnerable to mental health or addiction issues if they're experiencing loss and grief?
Yeah, that's a great question. So anyone who's already living with a condition is going to be more vulnerable, and it'll be a little harder, perhaps, for them to recover from a disaster.
How has that grant helped to bolster Missouri's response to disasters and also the mental health disorders?
We were able to pay for naloxone distribution around the state for those counties so that we can prevent overdose deaths and save people's lives, so that is great. And I hope Missourians will find some sense of relief and confidence in that you've got a lot of people who care, who are working on it around the clock, year long, whether it's sunny skies or stormy skies. You know, people have dedicated their profession, they've dedicated their work to really trying to help Missourians. We have a whole division that focuses on prevention, and they go into schools, they work with merchants, they work with community groups, they work with families to provide education. And you know, prevention is about helping people gain the skills and the info that they need so that it prevents them from using substances or from developing those long-term addictions.
Anybody's vulnerable to substance use and substance use addiction.
It's not something you talk about once and then you're done. It's really, really important that you have these conversations with young people really early and then often after that.
I'm the director of one of the 11 prevention resource centers in Missouri. We serve 8 counties in southeast Missouri with a variety of prevention services, substance use prevention services.
Prevention is possible because how is substance use prevention possible in your view?
Well, we know substance use prevention is possible because it's really just building upon the wonderful things that exist in communities already. Research shows us that when a community wraps their arms around young people, providing different strategies at multiple contexts, different levels, that are culturally competent, this does result in a decrease in substance use.
We call it reducing risk factors for substance use addiction, or building what we call protective factors. Protective factors kind of shield a young person from developing an addiction.
Something that's a little bit more difficult to talk about is intervention. We hear about these stories and see them on TV, these wrenching stories of intervention by either loved ones or colleagues. So at what point is intervention appropriate, and how can we apply that to prevention?
Well, in the field of prevention, we really work on a spectrum. So we have universal prevention programs that are made for everyone. That's like policy change advocacy. We have selected, which is where we look at more target audiences, and then indicated, which is where we're talking about somebody that may have already dabbled in a substance. Maybe they've tried something before, but we're not quite sure if they have a problem. You know, at any stage where somebody is concerned, intervention is appropriate. We want to build a foundation for them to understand the risks and the health impact of substance use at an early age so that they can form their understanding of it as they grow up. It's also really wonderful to include them in the prevention process. Having young people really helps us inform, our best practice strategies as well.
So Missouri's Prevention Resource Centers work to improve outcomes for individuals and for communities in Missouri. Part of what they're doing is merchant training. What is that? What part can merchants play in prevention?
Well, I think that's a really good example of a statewide outcome that we've been a part of. Over the years, we've developed a merchant education program where we go into every retailer in the state of Missouri who sells tobacco, and we provide them information about preventing sales to kids, how to check ID, how to get free training for their employees on how to check ID. And over the years, that sales rate has gone from 40% to 10 or less percent.
We're talking about carding.
Yeah, so if we reduce that access, we're reducing the likelihood that a young person is going to use a substance.
We haven't talked about discarded drugs. So what part do discarded drugs play in this, and are there drug disposal programs?
Yeah, one of the things we know is that when young people use perhaps a prescription medication that's not prescribed to them, that often they get access from a friend or a family member from those medications just in the home. Again, over the last several years, we've developed lots of opportunities for people to safely dispose of unused, unneeded, expired medications through disposal boxes. Many law enforcement agencies today have disposal boxes where you can simply take your medications in the bottle, literally dump those in a disposal box, and then they'll be safely disposed of in an environmentally friendly way. We also oftentimes provide pharmacies and other medical care providers what we call disposal pouches. They're pouches that have inert substance in them that mixes with a medication. You add a little water to it, and it makes those medications so that they can't be used in any way after that. So it's, again, a safe, environmentally friendly way of disposing of unneeded medication.
Jamie, thank you for being with us.
Thank you.
Jamie Myers with the Prevention Consultants of Missouri, serving Southeast Missouri and several counties there. Kristen, how is this work of prevention possibility, how is that affecting communities? How are they benefited by this?
When communities have engaged prevention plans, best practice prevention plans, when they're working with community coalitions, when there's prevention in the schools, when we have best practice policy in place, we really see, improved outcomes in terms of substance use prevention. We see decreases in alcohol and substance use. We also see communities where we can talk about prevention. When substance use does occur, nobody's afraid to talk about it. We can decrease that stigma. And then when people need help, there are resources there to help them. And those three things are the biggest things we want to see in our communities and that we do see when we are working in prevention.
What have I left out, Kristen, that you'd like to add to this?
Just that prevention is the key to unlock so many other wonderful things in our community. There's no silver bullet when it comes to prevention. There's not one strategy that's going to make everything better. However, we do see that slow incremental change can happen, and those changes compound over time. Substance use doesn't exist in a vacuum. It impacts all different parts of our lives. I don't think there's any person that can say they don't know someone who's been impacted by substance use. And we also know prevention works. So when we invest in prevention, we're really investing in the future of all of our children.